we depend on them every time we move. Walking, sitting, standing, and bending all require the human body's bones, muscles, and joints to work properly. In fact, more than 600 muscles, 1,300 tendons, and 200 joints, a maze of tissue, ligaments, and cells, provides protection, stability, and movement for our bodies and make up the anatomy of the musculoskeletal system. Yet there are many factors that can make the locomotor system, as it is often referred to, weak, fragile, and more vulnerable to long-term injuries or disorders.
Some of the common cases that we see are low back pain, neck dysfunctions, rotator cuff injuries. Low back pain actually accounts for 10 million people a day calling in sick to work. There's a loss of productivity of $14 billion a year, and about 100 million people suffer a year from neck and back pain.
Statistics show musculoskeletal disorders are among the most prevalent and costly medical problems in the United States. More than $800 billion was spent on medical costs and treatment in 2007 alone.
The number one reason that so much money is being spent on musculoskeletal disorders is there's a void in diagnostics to accurately identify these types of problems. Currently, they're using methodologies such as muscle relaxants, painkillers, anti-inflammatory drugs, and in a lot of cases surgery. And these things are covering up the symptoms. They're not dealing with the actual problem. When surgical intervention is used, the end result usually isn't that successful.
Billions of people throughout the world suffer from musculoskeletal disorders, which is one of the most common and notorious causes of severe long-term pain and physical disability. The World Health Organization has created a task force to help solve this rising global epidemic.
What's being done to correct the problem is a 10-year task force was created called the Bone and Joint Decade. The Bone and Joint Decade is represented by the top medical and scientific communities in 96 countries. It's been in place for 8 years now, but even then, we're showing little to no positive results. The reason they haven't been able to solve these musculoskeletal dysfunctions in general medicine is we don't have the right technology. To be able to track human motion, you're talking about watching 230 joints, over 650 muscles, and 1,300 tendons, all in motion, all affecting one another, creating these types of dysfunctions. No human being is capable of tracking all these things simultaneously in motion.
Experts say that an advanced understanding of the musculoskeletal system and its disorders is critical in order to improve prevention and treatment. Today, there is emerging technology that may be the missing link. Sherlock-NMD is developing a non-invasive web-based diagnostic system that can record and analyze a person's range of motion in a full 3D environment.
The system contains a database. In the database, we have these three-dimensional envelopes of function. So it's a perfect functioning man and a perfect functioning woman. There's a slight difference between the two. Then it contains a 3D human anatomy model set to medical standard. We then take a special envelope and create your three-dimensional envelope of function using your measurements. Based on your measurements, the technician working with you will be guided to take these little sensors that track flexion, extension, rotation, acceleration, all the different movements that your joints can make. And he puts them in the little stabilized sleeves within this physical suit that you're wearing. And they're going to track what all the joints in your body are doing very, very specifically. Then we have you move. You can be up to 500 feet away from the practitioner as long as there's nothing between you. And the practitioner is going to be watching your three-dimensional model to exactly what you are doing in motion, running, jumping, doing flips and splits, and your three-dimensional model is doing exactly what you are doing. Then the artificial intelligence engine will compare the perfect you in those three-dimensional envelopes to the current you and quantify any of the differences. So if your shoulder is internally rotated 3 degrees past its perfect position, we're going to know it exactly.
The real-time diagnostic system will be the first of its kind to detect, prevent, and treat musculoskeletal injuries and disorders.
Technology like Sherlock-NMD can help solve this growing epidemic by filling this giant void in diagnostics. It's the first of its kind diagnostic system to actually track human motion, to accurately identify biomechanical flaws that are being created in motion.
Physicians, sports team trainers, and physical therapists, among other medical professionals, will be able to use the revolutionary system in numerous beneficial ways.
The information that the system will provide is an accurate diagnosis. It'll track the efficacy of different therapies, any therapy being used for musculoskeletal conditions, timelines, approximate costs incurred, and then it'll help create the best preventative follow-up program.
Sherlock-NMD is a diagnostic tool that leads to less trial and error medicine, less surgeries, and ultimately cut the costs in the medical industry.
One of the key advantages of the system will be its ability to validate the use of current diagnostic technologies such as X-rays and MRIs.
Sherlock-NMD can help prevent some of the reductions that other medical diagnostic technologies are faced with by allowing the patient's medical staff to take an X-ray report, MRI report, and ultrasound report and input them onto the patient's three-dimensional model to show how the patient's body is being affected by that specific condition, which can only be shown by those specific technologies.
Well, everything about an athlete is movement. So Sherlock-NMD really works best with athletes. Sherlock-NMD will show that the player's biomechanical dysfunctions and will show the cause of their performance weaknesses and player mechanic issues and faults. And if identified, then this system will go and show and help a player identify those dysfunctions and help them prevent further injuries and be more successful.
In the future, the cutting-edge versatile tool has the potential to provide early diagnoses for injuries and dysfunction, as well as musculoskeletal diseases such as Parkinson's and multiple sclerosis.
The creators of Sherlock-NMD, Daryl Lajeunesse, and myself have 3 more generations already in the works that will help identify other types of musculoskeletal conditions, i.e. MS and Parkinson's, and other physiological diseases that people are faced with.
Sherlock-NMD is charting new territories in the field of musculoskeletal injuries and disorders, providing a better picture for a healthier tomorrow. For more information on Sherlock-NMD, please visit sherlocknmd.com.